Welcome to the Blue Book Podcast. Today's Blue Book Podcast from Seniors Serving Seniors features a conversation between Dr. Leah Tidey and Jordan Monks. Jordan is studying the prevalence and transmission of sexually transmitted infections in women over 60. Her research includes launching a survey among older women about their experiences. Listen as Leah and Jordan let you in on the details.
Hi, Jordan. How are you doing?
I'm good. How are you?
I'm really good, really good. I'm excited to chat with you today about your research. As your committee member, of course, it's a project that's near and dear to my heart. But why don't you introduce yourself, and then I'll introduce myself and the name of the project.
Yeah, so my name is Jordan Monks. I'm a master's student at the University of Victoria. I'm in the Social Dimensions of Health program. I guess I'm in my third year now. I've been working on this project for a little while, so I've gone a little past maybe the normal amount of time people take in the program. But yeah, that's mostly what I've been up to at the university.
Excellent. And can you just tell me the name of the project as well?
Yeah, so the project I'm working on, which is my master's thesis project, is called Exploring the Social Determinants of Health Associated with Sexually Transmitted Infections in Older Women.
And we're going to talk about why that's important work as well. Before we get going, folks who are listening, my name is Dr. Leah Tidey. My pronouns are she, her, and I'm a postdoctoral fellow at the University of Victoria in the School of Public Health and Social Policy. And I've known Jordan for quite a few years now. She came on and worked with me during her undergrad on a project working with older adults and youth talking about sexual health and creating a play around sexuality. And what's been really exciting is that Jordan has really taken this up and then started her own research based on this topic. So why don't you tell me a bit more generally, what is this project about? Why STIs in older women? Give me a bit of a gist of what's going on.
Yeah, so when I was originally working with Leah on her PhD work, I started talking to older adults, and something that kind of kept coming up in the literature was how sexually transmitted infection rates were increasing. And older adults didn't really know anything about this, at least the ones that we were talking to. They didn't know that this was a problem. They didn't know that they were a group that was susceptible to sexually transmitted infections. And they didn't really have a lot of education around it. They didn't know how to talk to physicians about it, to nurses, to their partners. And so that kind of just got me thinking, what's going on here? Why are these rates increasing? And just, what can be done about it? And the project, from learning about that and talking to these older adults, the project really stemmed from wanting to collect that data of just what's happening here. We really wanted to take a social determinants of health lens. So that just means looking kind of at, the causes behind the causes, what, not just that surface level, this, percentage of people is getting STIs, things like that, but just really looking behind what's actually happening here, what groups are really susceptible, what groups need to be targeted for maybe further intervention, things like that.
Yeah. One of the things that we've talked about a lot before is that stigma piece, and that's something that's come up in your preliminary work. But yeah, talking about sexual health is something that a lot of older adults haven't had access to do. It wasn't a part of their own upbringing, and it's not a part of a lot of the conversations that they have now. And like you said, it's having these impacts, and it's not just the STIs. Of course, it's all of these other things that are going on. Do we have access to a clinic? Do we have resources that are dedicated to older adults that are using language or resources that are appropriate for them? So it's really exciting for me because, we don't fully know what to do to address it until we hear from older adults first. And really that's where your work comes in. Do you want to share any more about, kind of what you're hoping to do? I know you have the survey, and then what's happening after the survey and with those results?
Yeah, well, as you're kind of just talking about here, I think the goal for us is we want older adults and older women to have healthy sex lives, and we want them to enjoy their sex lives and their sex lives be full of pleasure and intimacy. And we don't want them to be worrying about things like sexually transmitted infections. And so with that comes, having the knowledge and the background on how to not have this affect negatively their sex lives. Through this survey, we want to, like I said, collect the data of what's going on here. We want to take a couple interviews one-on-one after the survey. And from that, we want to take that information further. We want to see from that, what can be done here. Are we going to take this to physicians? Maybe further conversations need to be had in the doctor's office. Maybe things like more routine sexually transmitted infection testing needs to be done. I think things like that, just maybe on a yearly basis, like a couple monthly basis, could make a big impact. And having these conversations, I think, is really important as well. I think encouraging, older women to talk with their partners about this, whether this be new partners or, partners they've had for a long time. I think these are conversations that maybe just needs to be slightly encouraged, And so I think it really depends on what kind of comes up from the data of the project, what the exact next steps will be. But I think just opening up the dialogue is really important, and I think that's the number one step here is just, letting these older women and older adults know that this conversation's okay. And it's not, they don't need to be ashamed about it. And kind of releasing some of that stigma that might be behind this topic.
Mm-hmm. I think it's really exciting as well. I mean, listeners, you can't tell, you can't see us right now, but Jordan and I are both young women. But it's something that, thankfully we have had access to, not great, but a little bit better sexual education than many of our older peers. But just to end that stigma piece and to really center pleasure. I'm really happy that you mentioned that, because I think that's a really important aspect that we forget about. It's not just about like diseases and all these negative things that can happen when we are sexually active, but also remembering that this can be a really important part of our vitality, however we choose to express that. So it's really exciting that we are talking to folks who often get left out, and we're realizing more and more in research and other things that we're like, hey, this is kind of a missed opportunity, and older adults are getting it on and they need better information about it. They need to be able to talk about it.
Yeah. And I think that's really, like I said, the goal behind my project is, I think, collecting that data and then finding out what can be done to further those resources and further, these conversations. Because I think right now, older adults and older women specifically are feeling like they're left out of this conversation. And so we want to change that. And we just need some data behind it before I think some bigger changes can be made. So I'm feeling, really excited about, I think once we have, some of this work done, I think a lot of things can maybe, start to move in that more positive direction.
Absolutely. So if folks want to get involved, what are their next steps in order to, be involved in the survey, to get in contact with you? What do you want folks to know?
Yeah, so we're going to put a link in the description to this podcast directly to the survey. It's for older women, so 60 plus, who have had at least one sexual partner in the past year and are living in British Columbia, Canada. And if you have any further questions about my work, the survey, we're also probably going to do a little bit of collection of data at some community centers. If you wanted some further information around that, you can contact me. My email is jordanmonks@uvic.ca. I'll also have that put in the description. So it's just JORDANMONKS@uvic.ca. So I'm open to any discussions if anyone wants to get in contact with me to talk about my work further.
Thanks so much, Jordan. I'm really excited for this next step in your research, and folks who are listening, hopefully you can check out the survey, or if that doesn't relate to you, send it to someone who does, right? Someone who does want to have this conversation. So that's older women who are 60 and above, living in British Columbia, and who have had a sexual partner in the last year. Am I right, Jordan?
That's right. Yeah, Leah. Perfect. Yeah, and thank you so much, Leah, for Leah's one of my great community members on the project, or not community members, I guess, committee members on the project. And where can people find you further, Leah?
Yeah, if folks want to know more about the work that I do, I also have a podcast called The Love Doctor. You can find The Love Doctor hosted by myself, Dr. Leah Tidey, anywhere where you get your podcasts. We talk about sexual health generally, people of all different ages. If you liked this episode talking about older adult sexual health, I have an episode with Joan Price, who is known as the senior sexpert. So if you want to check that out, please feel free.
Leah Tidey is a postdoctoral fellow at the University of Victoria and the University of British Columbia, and she is the host of the Love Doctor podcast. Jordan Monks is a Master's of Science candidate at the University of Victoria. If you are interested in being part of Jordan's survey, you can contact her at jordanmonks@uvic.ca. Seniors Serving Seniors is a volunteer organization promoting the quality of life and well-being for seniors in the Greater Victoria area. Our core programs include the Seniors Service Directory, Return to Health, Seniors Link, and the Seniors in Stitches program. For more information about our programs, visit sssbc.org. And remember to click on the subscribe button to be notified when our new podcasts come out.